I'm going to talk about cardiac emergencies, which can be caused by disorders that affect the condition and function of the heart or blood vessels. For example, electrical or mechanical malfunctions of the cardiac conductive system. Asystole is a condition in which the heart stops generating electrical impulses. Pulseless electrical activity is a condition in which the heart's electrical rhythm remains normal, but the mechanical pumping activity of it does not, causing cardiac arrest. Many conditions are caused directly or indirectly from changes in the inner walls of arteries. Tachycardia is a fast heart rate above 100 beats per minute. Bradycardia is a slow heart rate below 60 beats per minute. Palpitations are from a fast or otherwise irregular heartbeat. A patient may say it feels like a fluttering sensation in the chest. A hypertensive patient has a systolic blood pressure greater than 150 or a diastolic blood pressure greater than 90. A hypotensive patient has a systolic blood pressure less than 90. Acute coronary syndrome, aka cardiac compromise, refers to the heart muscle not getting enough oxygen. It's important to keep a patient's oxygen saturation level at least 94%. A patient with acute coronary syndrome may have chest pain that feels dull, crushing, or squeezing. The feelings may radiate along the arms down to the upper abdomen or up to the jaw. The patient may complain of difficulty breathing, nausea, but it's uncommon for them to lose consciousness. About a quarter to a third do not have chest discomfort. This is particularly true of older patients and women. Instead, they may complain of dyspnea, sudden sweating, or a sudden unusual feeling of fatigue. A thrombus is a clot that is attached to the inner wall of an artery or vein. It can be an obstruction that restricts blood flow. This causes tissue beyond the point of the blockage to be starved of oxygen and possibly die. Or the thrombus, the clot, may break loose and become an embolism somewhere else in the body. Recall, coronary arteries are these special blood vessels that supply the heart muscle with blood and thus oxygen. Coronary artery disease occurs when coronary arteries are narrowed or blocked, for example, due to plaque buildup. Again, blood flow is reduced, thus so is oxygen delivery. This is aggravated by exertion because an increase in heart rate increases the need for oxygen. So think about it. If a patient is running a few miles and their heart rate increases and they need more oxygen, if they have CAD, this is going to be a problem because their coronary arteries are narrowed and it can't deliver as much oxygen to the heart. An aneurysm is the dilation or ballooning of a weak section of the artery. This may burst and lead to internal bleeding. Angina pectoris is pain in the chest. Once CAD narrows arteries, the portion of the myocardium, the heart muscle that's supplied by them, starves for the oxygen, as I mentioned. Usually the pain lasts no more than 30 minutes. Acute myocardial infarction, aka heart attack, is a condition in which the a portion of the myocardium dies as a result of oxygen starvation. This may be caused by CAD, chronic respiratory problems, unusual exertion, even severe emotional stress. Sudden death is a cardiac arrest that occurs within 2 hours of the onset of symptoms in a patient that may have no prior history of cardiac problems. Congestive heart failure occurs when the heart doesn't pump efficiently and leading to excessive blood or fluids in the lungs, the body, or both. The fluid buildup can lead to edema, swelling. Some signs and symptoms of this are tachycardia, dyspnea, elevated blood pressure, cyanosis, diaphoresis, cool, clammy skin, anxiety or confusion due to hypoxia, pulmonary or pedal edema. Pulmonary edema occurs when there is damage to the left side of the heart, which receives blood from the lungs. If there is damage to the left ventricle, for example, this can lead to blood backing up into the pulmonary circulation and then the lungs. A patient that has pulmonary edema, you may be able to auscultate rales, bubbly, crackly lung sounds. They may also cough up blood-tinged sputum. Pedal edema occurs when there's damage to the right side of the heart, which may be a result of the damage to the left side. The right side of the heart receives blood from the body and pumps it to the lungs. If the lungs are congested, they can't receive any more blood. So fluid may accumulate in the dependent lower extremities, for example, the liver, the abdomen, which would result in abdominal distension, and edema in the feet and ankles, swollen feet and ankles. If the patient is bedridden, it may lead to edema in the sacral area. And one last quick important note before I end this video. Causes of cardiac arrest in children are usually from respiratory problems. Respiratory problems are usually the cause of cardiac arrest in children, as opposed to these conditions that I discussed, which are more commonly the cause of cardiac arrest in adults. And that is the end of this video.